Good day everyone, I am Riabelle Cinco, a nurse student from Asian College of Technology, and now I am going to perform a bag technique. So first, what is bag technique? Bag technique is a tool by which the nurse, during her visit, will enable her to perform a nursing procedure with ease and deftness, to save time and effort with the end of view of rendering effective nursing care to clients. So what is public health bag? Public health bag is an essential and indispensable equipment of the public health nurse which he or she has to carry along when he or she goes out for home visiting. It contains basic medication and articles which are necessary for giving care. So what are the principles of performing a bag technique? Performing the bag technique will minimize, if not prevent, the spread of any infection. It saves time and effort in the performance of nursing procedures. The bag technique can be performed in a variety of ways depending on the agency's policy, the home situation, or as long as principles of avoiding transfer of infection is always observed. So the contents of the public health nurse bag included a paper lining, extra paper for making waste bag, plastic lining, apron, hand towel, soap and soap gauge, thermometers, oral or rectal, 2 pairs of scissors, surgical and bandage, 2 pairs of forceps, curved and straight, disposable syringes with needles, hypodermic needles, sterile dressing, cotton balls, cord clamp, micropore plastic, tape measure, 1 pair of sterile gloves, baby scale, alcohol lamp, 2 test tubes, test tube holders, solutions of betadine, 70% alcohol, zipperan solution, hydrogen peroxide, spirit of ammonia, ophthalmic ointment, acetic acid, and Benedict solution. So if you have BP apparatus and stethoscope, this must be carried separately and are never placed in the bag. So these are points to consider or to remember. The bag should contain all the necessary articles, supplies, and equipment that will be used to answer the emergency needs. The bag and its contents should be cleaned very often, the supplies replaced and ready for use anytime. The bag and its contents should be well protected from contact with any article in the patient's home. Consider the bag and its contents clean and sterile, while articles that belongs to the patients as dirty and contaminated. The arrangement of the contents of the bag should be the one most convenient to the user, to facilitate efficiency and avoid confusion. Upon the arrival at the patient's home, place the bag on the table lined with a plain paper. So first I am going to put the paper naming at the table. The flip side must be out and the folded part touching the table. So this is the flip side and this is the folder part which is touches the Wash hands using soap and water. Wipe to dry. So the rationale for this is to prevent infection from the care provider to the client. So I will put this one to the right side. And the next thing that I am going to do is to take out the apron. So rationale for taking out the apron is to protect the nurse uniform while assessing the patient's the next thing to do is to put out all the necessary articles needed for the specific care. So now I am going to perform a Benedict test to the patients. So the rationale for this is to have them readily accessible. So I have here the treatment, clean all things that were used and perform hand washing after cleaning all the necessary things that I have been used during performing to the patient. So I'm going to get in cotton balls and a 70% solution of alcohol. After the procedure that has been done with my patient, I am going to remove the apron, folding it away from the person, the soiled side in and the clean side out. So the rationale for this is to remove the apron, folding it away from the person, and soiled side in and clean side out. Place it in the bag. Of patients in absence of the nurse. Make the appointment for the next visit, either home or clinic, taking note of the data and time.